Good evening. I'm Jeff Spence from the Office of Alumni Relations at Thomas Jefferson University, and I'm happy to welcome you to this evening's discussion. Tonight, we will discuss mindfulness for stress reduction with our speaker, Dr. Diane Reibel. In her talk, Dr. Reibel will help us define mindfulness, discuss current research on its health benefits, and offer practical exercises to strengthen your ability to be present in the moment with less reactivity and greater ease. Throughout tonight's talk, we invite you to share any questions you have using the Q&A button located at the bottom of your screen. If you don't see the button, try moving your cursor and it should appear. You may use the chat function to respond to prompts from Dr. Reibel. Please do not submit questions there. Now it is my pleasure to introduce tonight's speaker, Dr. Diane Reibel. Dr. Reibel is the director of the Myrna Brind Center for Mindfulness at the Marcus Institute of Integrative Health and clinical associate professor in the Department of Integrative Medicine and Nutritional Sciences at Thomas Jefferson University Hospital. She is a well-respected expert and author on mindfulness, having taught mindfulness-based stress reduction for more than 20 years, being cited in and publishing in both scientific journals and the popular press. Dr. Reibel, thank you for joining us this evening. The floor is yours.
Thank you, Jeff. Well, good evening, everyone. It's good to be with you in this virtual space. And my intention for this evening is indeed to speak a bit about mindfulness, and specifically in the context of mindfulness-based interventions that are being used in healthcare and medicine, and then to speak a bit about the research, and then to really guide you through some mindfulness practices so you can have a direct experience of a formal practice and see how that affects your own body and mind. And also to speak about resources if you would like to continue to learn more. And of course, we'll have time for questions and answers. So what I'm going to do is I am going to share a PowerPoint to start with. So let's begin by defining mindfulness. And again, there's many, many ways to define mindfulness. And tonight I'm going to specifically define it in the context of mindfulness-based interventions. So John Kabat-Zinn, who is a person who founded mindfulness-based stress reduction 40 years ago, defines mindfulness as the awareness that arises from paying attention on purpose in the present moment and non-judgmentally. John is a dear teacher, a friend of mine. And if any of you know him, he definitely likes to use lots of words. So what I would like to do is unpack this a bit for you. And looking at the next slide, here's a model of mindfulness. And there's 3 axioms: intention, attention, and attitude. So the intention to be mindful is to be present, to be aware of what's happening in the present moment. So the attention is placed on what is happening, both inside yourself as your own experience, and as well what's happening in the environment around you. And you choose where to place your attention. And then attitudes, which we really highlight. These are quite important because we can certainly have an intention and have our focus very much on what we want, but very, very tight. And that isn't what this is about. This is having an open, curious attention one that is non-judgmental, as John Kabat-Zinn says, and one that brings kindness into the moment as much as possible. And just to note that these three axioms are engaged simultaneously in the process of mindfulness. This is not a linear process by any means. I also want to mention that mindfulness is a natural human capacity. We all have this ability for being present and aware. And I am sure you have had many times in your life where you were really present, very much aware, open to the experience. Sometimes it's when we're in nature, listening to music, in relationship, where we just become really present. Now, while mindfulness is innate, it can also be cultivated through the formal practice of mindfulness meditation, right? And as we practice formally mindfulness meditation, then what we find is our ability to be present and aware in our daily lives is increased. And mindfulness-based interventions come into play here in that they involve training in mindfulness meditation so that we can cultivate this present moment awareness. So I'd like to speak a little bit about these mindfulness-based interventions, starting with mindfulness-based stress reduction, which was the very first one. Again, that was founded by John Kabat-Zinn, and it was established at UMass Medical Center in 1979. Just so you get a sense for this formal program, it is an 8-week program. People meet once a week for 2.5 hours. Plus, there's a full day of practice. So this is a very extensive program in that way. It is really designed for people to really learn mindfulness practices and to steep in them. It is educational and not therapeutic in orientation. So it is group, but it is not group therapy. I will say, however, as you'll see with the research, it is quite therapeutic. The classes really help people to bond, to support one another, offering a sense of belonging. I'll even mention that we've moved our classes online, and we still hear that people are saying they have a sense of belonging and are feeling really supported, which is really good to know. And when John first began mindfulness-based stress reduction in the hospital setting, it was for patients with it was really medically heterogeneous environment for patients, no matter what they were actually dealing with. And mindfulness-based stress reduction now is offered in greater than 700 medical centers in the United States and around the world. 40 years of research now. And MBSR and other adapted programs, these mindfulness-based interventions, have really expanded. Perhaps you have actually heard more and more about this. You can find these programs in corporations, in the military, universities, schools, and now more and more, which is really, from my perspective, incredibly wonderful, more and more programs for children and adolescents. So just to give you a little bit of what's been happening here through the years, we started with mindfulness-based stress reduction. And then people have basically used similar format, but integrated other therapies and interventions into the program. So for example, mindfulness-based cognitive therapy, which has been used for people who are depressed and have relapses. Mindfulness-based relapse prevention, and that is for people with substance abuse. Mindfulness-based art therapy, which actually was developed here at Jefferson And that is for cancer patients. Mindfulness-based eating awareness, mindfulness-based recovery. And what we say right now in the field is it's mindfulness-based, you name it, ETC, because there are so many iterations of mindfulness-based programs right now happening. So let's just speak a little bit about the research that has taken place. And here is a graph of mindfulness in journal articles published from 1980 till last year, 2019. And what you'll see is, in the 80s, 90s, a handful of articles, in 2000, just a little bit more, and then an exponential increase in articles, people doing research on mindfulness, the effects on health, health-related quality of life, the effects on physiology. Just to mention, our first research article that we published from Jefferson was in 2001, and that was health-related quality of life in patient population. Again, at that time, it was about 10 articles. And then our second paper, which was mindfulness for medical students, was in 2003. So we've actually been involved pretty early on with some of the research in the field. So the stress reduction program here at Jefferson was established in 1996. I actually was fortunate enough to come in at the ground level and co-founded the program. And we began, my first program was actually a program for the medical students, which I'll talk about in a little while. And then we began the 8-week MBSR Foundation course, which we offered every season, several courses. Again, I want to mention now that all of the group programs have been transitioned to online programs. And in addition to that, we are really doing our best to support healthcare professionals and the community at large, so that we are actually now offering, it's been for the last 4 months, daily guided meditation practices at 12:30 to 12:45 during the week. And I've been working with Urban Center at Jefferson to reach communities as well. So we continue to work with medical students, residents. We offer programs for healthcare professionals, mindfulness at work. We teach people, professionals, how to teach MBSR and mindfulness. And again, we have community outreach. From the very beginning, we've been bringing programs into homeless shelters for residents and also for staff. And we've also been going to federally qualified health clinics and been working with elders now in CCRCs. So that's kind of a snapshot of what we've been doing through the years. And again, I'm fortunate enough to be able to be here, and we're coming into our 25th year next year. So we have also done over 20 years of research, and I spoke a little bit about this already. In addition to what I already said, we've done some work with MBSR for glycemic control, type 2 diabetes, MBSR for chronic pain. Our most recent work is MBSR for elders and looking at brain functional connectivity. So perhaps you can just take a moment and look at this little cartoon. What's that? Oh, it's just my mind. And see if you can actually relate to this. I think there's quite often that our minds can be very scattered, very full, overloaded, um, and not present. So take a moment. It's never a better time than now to really take a moment and notice what is happening in your mind right now. And keep in mind that the type of attention we bring into the moment is one of curiosity and openness. You might find that your mind is scattered. You might find that you're really drowsy right now. It's easy to become drowsy at this time of night. And whatever you find, as much as possible, not judging, just noticing. And also notice that with intention, you can choose to bring your mind and attention right here into the moment. And just notice that you are listening to me and that there's a cartoon on the screen. And so see for yourself if that's possible. Again, we can, choose where our attention goes. It doesn't mean it's going to stay there, but we can choose that in this moment. So see for yourself as we move on. So I'm just going to briefly speak about the research because there's so much that I have chosen to really show more of the reviews and meta-analyses. And this is 47 randomized controlled trials over 3,500 people. And the studies did use active control groups in which the amount of time and attention was comparable to that of the mindfulness program. So early on, the research really was just observational, pre-post MBSR, but with time, of course, this randomized trials and active controls. And what was found is that the mindfulness meditation program showed significant improvements in anxiety, in depression, and in pain in diverse clinical populations, including chronic pain, heart disease, IBS, breast cancer. And then there's been research done in healthy individuals, so not clinical populations. And this is a meta-analysis of 29 studies, which showed that people who, this was specific to MBSR, took the 8-week program, showed reduced stress, anxiety, depression, burnout, and improved quality of life. Also, just to summarize, participation in MBSR has been shown to result in improvements in some selective immune markers, in sleep quality, in emotional regulation, in some aspects of cognitive function, sustained attention, and working memory. That's primarily been done in healthy young adults, although there's some evidence in clinical populations. And then brain changes. So as far as brain changes go, this is more recent, the last decade or so, with increased technology, looking at the brain and neuroplasticity. I remember when I went through school, and this dates me way back, and I was taking physiology, I was actually taught that, you have a certain number of brain cells when you're born, and then as you get older, they actually just die. And people were not talking about neuroplasticity. Of course, now we know that the brain is plastic. It changes based on experience. And certainly people who had been meditating for very long periods of time, monks, they did various studies and found that their brains were significantly different than people who were not meditating. So they wanted to start to see if just the learning short-term mindfulness would actually affect the brain. And they did find early on in 2010, participation in MBSR reduces amygdala gray matter density, and it was associated with a reduction in perceived stress. Of course, the amygdala being part of the system that is involved with that fight or flight response emotional regulation. And participation in MBSR also increases regional brain gray matter density in regions associated with learning, memory, and perspective. And more recently, participation in a 3-day intensive mindfulness training showed reduced stress-related amygdala resting state functional connectivity. And this is one of the systematic reviews of 21 studies looking at brain function. And they found that the emotional and behavioral changes that people were reporting after participating in mindfulness-based stress reduction are related to both functional and structural changes in the brain. So what kind of used to be thought of as, well, you know, it's a feel-good thing to do and certain select people deciding to do this. Now, much, much more, there's some evidence, of course, that there's physiological changes. And I want to speak to this a little bit more. So research on mindfulness and brain changes really have contributed to increased public awareness and interest in mindfulness. And this is Anderson Cooper, who actually went on retreat with John Kabat-Zinn and has become an avid meditator and supporter of mindfulness practices. And he did a presentation on 60 Minutes about his experience. And there are many others who have also spoken about the direct experience. And again, this is really heightening public awareness. However, scientists really caution that research in this area is still in its infancy. I just want to bring that forward because oftentimes I see in popular press as if this is a magic bullet, you know, mindfulness is the latest thing, and it's going to solve all your problems and change your brain and so forth. And it concerns me a bit. No doubt these mindfulness-based interventions do have evidence base behind them, but there's a lot that we need to learn, like, you know, how much practice is required, what are the actual components that bring about the change, and, you know, there's lots that we still have to learn. So I want to definitely bring that up. So let's have a taste of practice now. And again, of course, this is not mandatory by any means. Anything that I guide is really something that if you would choose to do and to explore, then join in and see for yourself how it affects your own mind and your body. So this is called a breathing space. So for this practice, if it's comfortable, you can allow your eyes to close. You can also leave them open if you prefer and just have a soft gaze. And the first part of this practice is really just to become aware of what's happening in your own body and mind right now. So bringing your attention into the body as much as possible. Perhaps beginning by really feeling where you make contact with whatever it is that you're sitting on. And then noticing any areas of holding in the body. And for this moment, I'm Not asking you to change anything other than just to be attentive, just to be aware. There might be certain regions that there's more tension and certain regions where there's less tension. Anytime the mind wanders, see if you can just bring it back to the body, sitting and sensing how it is, sensations, and also how the mind is right now. Again, is the mind have a lot of thoughts, not so many thoughts? Is it drowsy? Are you relatively alert? And again, keep in mind, it's not about judging what you find. It's simply about noticing what's here now. And then when you're ready, bringing your attention to the sensations of breathing. Wherever you notice the breath most prominently right now, most strongly in the body. Some people notice the breath with the air coming and going in the nostrils. Others with rising and falling of the chest or abdomen. See for yourself if you can just allow your attention to rest on the breath. Noticing the full duration of an in-breath, followed by the full duration of an out-breath. Perhaps the beginning, middle, and the end of an in-breath. The beginning, middle, and the end of an out-breath. If the mind wanders, it's quite natural. No need to give yourself a hard time in any way. Maybe just noticing, thinking, and then bring the attention back to the breath. Just taking in life right now, one breath at a time, allowing the breath to be an anchor into the present moment. And then when you're ready, expanding your awareness now to include a sense of the whole body. And checking in again, noticing the body sitting here now. And just see for yourself if any shifts have taken place in the body or the mind. And just doing this short practice. And notice what quality or qualities are most present now. And see if you are present or not. Again, it's just see for yourself. It really is an exploration to see if this practice in any way has supported you to be here and to be present, and if any changes have occurred. So we're going to continue now. And just so you know, the instructions for the breathing space are here for future reference, and we're going to move on. I just wanted to mention that this was the second study that we did in 2003, so that you can see mindfulness for medical students. At that point in time, there was a sophomore seminar, 10 weeks. We were fortunate enough to be able to run a 10-week MBSR program, and it was a selective. And we looked at total mood disturbance with a profile of mood states. And total mood disturbance includes anxiety, depression, fatigue, anger. And we had a control group. It wasn't randomized early on, but we had a control group who had signed up for another selective of alternative and complementary medicine, which is what it was called at the time. And as you can see from this chart, to begin with, the people who chose the MBSR program had higher mood disturbance, and this makes absolute sense. That's who's going to show up, people who feel like they need the support and help to help with stress. So at first we thought, well, you know, I don't know what any of this data would mean, but looking at it and seeing this kind of crisscross phenomena, the statistician said this is significant. So what you will see is that the pre-values, although again, the MBSR and control were different to start with. Then we were coming into like 10 days before finals. What you see in the control group is that their total profile mood state is increasing, which is what most people notice happens to medical students before finals. And with respect to the MBSR group, they actually had a reduction in the profile of mood states coming closer to finals. So this was a brief study. Well, it was a 4-year study, but brief paper, but it was one of the first to start really saying that this might really be something for medical students. And there's so many schools now offering mindfulness to medical students, and we've been doing it now for like I said, close to 25 years, changes in the different formats, but we still are doing this for the medical students. And evidence for mindfulness-based interventions for clinician wellness. There was a 2009 study based on the 8-week program, 70 primary care physicians, and this was done by Nick Krasner, and he's in Rochester, and they run all kinds of programs for healthcare professionals. And based on this work, they found that the overall mood, empathy, personal accomplishments, all of these things on the burnout inventory were improved, perspective taking, total mood states, and improvements were maintained at 12 and 15-month follow-up. And then during the last decade, others have shown similar benefits, and there's been several reviews and meta-analysis being published. And the mindfulness-based interventions being studied include MBSR and MBCT and adapted programs, including telephone and web-based programs. So there's much happening in the field right now. And I'm going to move through this again, just saying that it's very beneficial with respect to burnout and exhaustion, and also with increasing self-compassion and empathy toward patients, therapeutic presence, really helping the healthcare professionals not only themselves, but being able to be more present with their patients, to listen more deeply. And you know this for yourself, when you're highly stressed, it's very difficult to be there for another. And when you can maintain your own center and your own presence, that it supports your ability to listen more deeply and be present for others. So, another short practice, and this is the clock that we have in our meditation space, the now clock, and it's a reminder to come present. Certainly you can still see the time, and also you can drop into the moment. So this brief practice is called pause, relax, and open. And it helps us to step out of autopilot and offers the possibility of consciously choosing new responses. This is really what mindfulness really is about. Rather than having automatic reactivity to what arises in our experiences, to support us to have more options for responding consciously. So again, if this feels right to you to explore this short practice, I'll guide you through, and the actual instructions will be on another slide for future reference. But for now, just pausing. And the pause really is mindfulness in the sense that it allows us to check in and notice what is really happening in the moment. So a wonderful gateway into the present moment is the body. The body is here now. So checking in once again, feeling the support beneath you and where you make contact. Really seeing if you can sense into being supported by what you're sitting on. And notice sensations in the body. Again, perhaps areas of holding, areas of comfort or discomfort. And again, keep in mind that the attention that we bring in is one of curiosity, openness as much as possible. And then the next step is to actually invite relaxation. So see for yourself if there are any muscles that can soften. Perhaps there's muscles around the eyes that could soften. Or if you're noticing tension in the jaw, perhaps allowing the jaw to drop down ever so slightly. And noticing how that affects the facial muscles if you've chosen that. Notice the back of the neck. And if indeed it feels right for you to move your head from side to side or round and round to support some softening of neck muscles, then choosing that. And perhaps even allowing the shoulders to drop down a bit or back a bit. And then just noticing how it is now in the body, in the mind. And then the last step is to open. And opening is to actually opening the senses to the external environment, so including sound. If the eyes are closed, gently allow them to open. Perhaps seeing the screen, perhaps beyond the screen into the space where you're located. And as you open to the visual field, as much as possible, staying in touch with the sense of the body, right? And just noticing what is here now. What quality or qualities are most present right here, right now. And if you would like, you can just take a moment and chat with me and let me know what is the primary experience in this moment in 1 or 2 words. What are you noticing? And I will look at the chat if anyone would like to just put out into the group, to me, and I'll just put it out to the group. You know, what are you noticing after doing this short practice? Relaxation, as one person said. Sleepy, not surprised. A sense of relaxation, less tension. Release. Comfort, less tightness. Peacefulness. Anything else that hasn't been said? I mean, there is always the possibility that someone can be more anxious. We wouldn't leave that out. It can happen. Slowing down of my busyness, ready to work. Vacationing. Okay, well, thank you for sharing this. And I am going to just, here's the instructions for pause, relax, open. And here also, I just wanted to let you know that if you want information on our programs, or if you want to access guided mindfulness practices, we do have MBSR practices freely available on our site. And so you can just go to www.jeffersonhealth.org/mindfulness. And again, you can see programs, but also on the home page, you can see the mindfulness practices. Also, I just wanted to say that we are doing the 15-minute practices. We've been doing them weekdays. In August, it'll be Tuesdays and Thursdays, 12:30 to 12:45. If any of you are interested in getting that Zoom link or sharing that Zoom link, it is open to the public. Just email us at mbsr@jefferson.edu. And we can send you a link for those live practices that we had started with the beginning of the pandemic to support the community. I also want to say, and this is the least favorite of mine to say, but it's so critical because we have a mission and are committed to supporting as many people as we can to take mindfulness programs. And we offer scholarships and offer free sessions. If any of you are called in any way to support that mission and would like to donate to our program, just email us at mbsr@jefferson.edu and we'll let you know how to do that. And especially now, we're offering a great deal to a lot of people and can use the support to continue to do that. All right, so here we have a time for questions, comments. So I'm gonna give it back to Jeff. Here you go, Jeff.
Thank you so much, Dr. Reibel, for a very informative exploration of mindfulness. I encourage everyone once again to share any questions you have for Dr. Reibel using the Q&A button located at the bottom of your screen. It looks like we have one that's already come in. So Dr. Reibel, could you speak on the overlaps that you're aware of between the Vipassana meditation and some of the exercises that you're sharing, or other forms of meditation?
Sure. So Vipassana meditation is also called insight meditation. And mindfulness, the way we teach it within mindfulness-based stress reduction, is a form of insight meditation. So that indeed, you know, when I go on a meditation retreat, I'm often going to what is called a Vipassana retreat, insight meditation. And that is what informs how I teach. So I want to say that in some sense, it's synonymous, okay? Vipassana, of course, comes out of the Buddhist tradition. And, mindfulness, the way Jon Kabat-Zinn started was also that way. But I do want to say that the way we teach it is much more universal. So we don't bring in, the Buddhist language, although it comes out of that. Then there's other forms of meditation. So for example, some people might certainly know about transcendental meditation. And that is a different form of meditation. That is a meditation that is concentration meditation, all right? Whereas mindfulness or Vipassana is more open awareness meditation. So as I guided, it was be aware of the breath, be aware of the thoughts, be aware of the body, right? Whereas transcendental meditation focuses on a particular mantra. So many different forms of meditation. Hopefully I've answered that question.
I hope so as well, but thank you. Another question that we have is wondering, aside from the work that you're doing, are there any medical groups that you're aware of that are set up to do this type of practice?
So with respect to medical groups, meaning like in doctors' offices or medical centers, possibly?
That's what I would assume from the question.
Yes, and the answer is yes to that. Yes. So you will find mindfulness programs often in university hospitals, but you can also find them. Doctors, I happen to know that there's some in the area who have teachers going in and running programs in their own offices. Yes.
Do you have any perspective on some of these mindfulness apps, things like Calm?
Right. So, so there's many ways to learn how to practice mindfulness, and right now there are many apps. Calm being one. Headspace, I notice, is advertising on television now since the pandemic, and Insight Timer, and it is supportive to a lot of people. It is. And we actually, after people do take our MBSR programs, we do, in our resource list, include the apps, right? There's not as much research that I can show you, evidence-based with using the apps, right? So I will say anecdotally, I've heard, fair number of people say it's helpful. There is one particular app, Dr. Judson Brewer, on unwinding anxiety and also changing the habit loop, where there is evidence-based. They're doing that. And the app is supported by live group sessions if you would want to do that. And from my perspective, again, and this is just my perspective, I really appreciate if people have ways to talk to someone about their practice. So rather than to do the practice and then have all these questions and not necessarily be able to have someone answer them, or if something's coming up for them, that they would know where to go or have somebody to go to. So I like that app in that they have the app, and then you can also join weekly a group and ask questions and so forth. Yeah.
Wonderful. Another question that we have is asking if mindfulness practices have been used successfully for pain relief.
Yes. So I will say that the very first paper in the late 80s was Jon Kabat-Zinn's paper where he did his program for chronic pain patients, and it found that it was very helpful to help reduce their pain, to improve physical abilities, and along with depression and so forth that goes along with pain. And And we actually have a mindfulness-based chronic pain program, and they have been shown to be effective in supporting people. Again, some of them programs and the research will say, yes, it reduces the actual pain. Some will say their relationship to the pain has changed and they're in much better shape psychologically. Yes, we actually did a chronic pain study at Project Hope, which is a health clinic for homeless, in an attempt to help people who are trying to come off of use of opioids. And this is something that is being used more and more, chronic pain.
Thank you. I think we have time for one more question, and probably a very timely one. Dr. Reibel, in your experience and in your perspective, how pertinent or more critical is mindfulness during times like the current COVID-19 pandemic? And why do you think it's important that Jefferson take the lead in this field?
Well, I think it's very important to be able to work with your own reactivity to what's happening, so that you can definitely reduce your stress and also be with the unknown, which also creates like enormous tension in most people. So there's no doubt in my mind that mindfulness can be incredibly supportive. I will say to you, I don't know how many times a day I tell myself, and I hear my other teachers say, thank goodness we have the practice. Thank goodness we have the practice, you know. And I'm really honored that we are doing the work at Jefferson, and that there's so many mindfulness centers now that are really reaching out to people in all kinds of ways during this time to offer support. And if I may just close with one brief quote, may I do that? It kind of goes along with that last question. And this is a quote from a woman who I would think many of you know, a wise woman who actually had many, many struggles in her own life, and somehow was able to ride them and to support people through laughter, actually, a lot through laughter. Life is about not knowing, having to change, taking the moment and making the best of it without knowing what is going to happen next. Delicious ambiguity. What a perspective. Delicious ambiguity. Gilder Radner. So this is mindfulness, really. This is what it's about. And of course, in times of change, in times of not knowing, being able to make the best of it. And mindfulness can really support us to do that. So thank you very much, Jeff.
Thank you. Thank you, Dr. Reibel. That's a wonderful note for us to end on. And we want to thank everyone who participated in this evening's talk. We encourage you to continue to come to additional events and programs that we have coming up. We encourage you to join the Marcus Institute of Integrative Health for its webinar series, A New Paradigm for Health Post-Pandemic, which will be held on Tuesdays at 7 p.m. Eastern Time from August 4th through September 5th. You can register at jeffersonhealth.org/tapestry of health. Alumni of our MBA in Strategic Design program are invited to come together for a virtual reunion on August 19th, and look for more alumni talks, events, and programs every day and coming soon at jefferson.edu/alumni events. Thank you again for participating in tonight's talk. I hope you all stay safe and well. Good night.
Good night, everyone.